Everybody, I will be presenting my free paper on Centralign software validation, achieving optimal visual access centration with the VisualMax 800. The authors are consultant at Carl Zeiss Meditech. So the first step, it begins when we take the location of the corneal vertex calculated in reference to the pupil center right from the atlas. The next, we enter that data into the VisualMax 800. Then when the treatment starts and as the eye approaches the contact glass, the pupil edge is identified and it is displayed as a blue dotted line. The Centralign then displays the vector difference between the corneal vertex and the current position of the treatment zone. Our aim was to validate the accuracy of the Centralign software, which is the centration guide that allows the surgeon to center the treatment on the visual axis in myopic eyes treated with small incision lenticule extraction using VisualMax 800. Our objective was to measure the deviation between the achieved and the attempted centration. The study included it was a retrospective analysis of 114 consecutive eyes enrolled in the study at the Netradharma Super Speciality Eye Hospital. All the surgeries were done by a single surgeon. The patients underwent SMILE with Centralign centration software of the VisualMax 800 femtosecond laser. The vertex of the coaxially fixated eye was aligned with the visual axis. In cases with large angle kappa, the surgeon centered in between the visual axis and the pupillary axis. The optical zone was then identified on the tangential topography difference map as the central zone up to the mid-peripheral power inflection point on the atlas. The best fitting circle and the central grid were superimposed on the optical zone to determine the location of the optical zone center with reference to the corneal vertex. Here we can see how the pupil margin is defined by the blue dotted line. Then you get the pupil center with the center blue cross and one yellow dotted line with the center green fixation light where the patient fixes. On starting the treatment, the Centralign measures the pupil margin as the blue cross, pupil margin the pupil center. The XY coordinates of the corneal vertex with respect to the pupil center is measured on the topographer and entered into the VisualMax 800, which is seen as the yellow dot. The patient then looks at the green blinking light and the green fixation light is connected. Here you can see in the video, now the green blinking light will be connected to through the yellow dot. Now as the centration is achieved, the dot becomes yellow. The green fixation light becomes a yellow dot. Now as the yellow dot will turn blue when the treatment is within 200 microns of the corneal vertex, and then the docking is done. The Centralign thus guides the surgeon to center the treatment. The blue dot consequently becomes smaller as the centration is more closer. Methodology: a tangential curvature preoperative and the postoperative 6 months difference map was generated for each eye using Atlas 9000. The fixed grid was superimposed onto the difference map to measure the offset between the center of the lenticule and the visual axis. Looking at the results, we can see the scatter graph combining the difference between the center of the deviation of the center of the lenticule from the visual axis. Here you can see separately. The first graph shows how the lenticule center is very close to the vertex apart from few outliers, which was because of the large angle kappa. 64% of the eyes were within 0.3 microns and 98% were within 500 microns. Similarly for the y-axis as well. The p-value was 0.916 for the x-axis and less than 0.01 for the y. The mean deviation achieved was within 215 microns from the attempted centration. The significant decentration of the y coordinates is attributed to the surgeon's method of aligning of the center between the pupillary axis and the visual axis in cases of large angle kappa. My references. Thank you.
Have you validated your results with any similar studies?
Similar, Dan Reinstein's study was there. They have also had similar results, and there was one more study of Liu et al. They have also concluded that there was a difference of around the center has been deviated along the y-axis about 200 microns.
Thank you.
Thank you.